Hey everyone, welcome back to another Fun Fact Friday live here at University Animal Clinic. I'm Dr. Sam, and I thought today I'd talk about dental disease, and specifically I get asked a lot about, part of why is dental disease so important and taking care of your pet's teeth so important. And one of the reasons is our teeth are an extension of other organs in the body. And so when we have bacteria and disease in our mouth, it can affect lots of other organs. And so there was some research, there's been a lot of research done, but one of the research studies showed that they actually can look at the severity of the dental disease and how that relates histologically, so under the microscope, to changes in the heart, the kidneys, liver, and even the lungs. So important to our pets as well as ourselves, our overall health and changes that we see in our overall health when it comes to dental disease. So in cats specifically, one of the main things we worry about, of course, is their kidneys. And so if we think about it, as we develop more and more bacteria on and under the gum line, more specifically under the gum line, that's the most worrisome bacteria. That actually wears away at the protective barrier that our body has between our bloodstream and our gums. And as that breaks down and that bacteria crosses that barrier, it then gets into the bloodstream, and our kidneys are the organ that needs to filter that. And so once that happens, this is now relying on the kidneys to catch that bacteria and remove it from the body, which over time can cause damage and can lead to a greater incidence of chronic renal failure. So our cats, as true carnivores, are already prone to this. And so by adding that additional work that kidneys have to do to filter out this extra bacteria, we're now making that worse. And there have been some studies that have showed that when our cats are diagnosed with periodontal disease, so specifically that very severe gum disease, that they have a greater incidence of chronic renal failure. Our dogs, they also have a lot of incidents of kidney disease linked to dental disease. So the same process happens in them. We don't worry about it when we worry about it, but our cats are way more prone to renal disease for them. In our dogs, one of the things we see is actually heart disease, specifically endocarditis, which is inflammation of the valves of the heart. Our smaller breed dogs are prone to things like mitral valve regurg and certain valves that get loose and kind of flap, and that's what we hear as a murmur genetically. But if they also have periodontal disease, again, that bacteria is getting into the bloodstream, the blood has to pump through the heart, and that bacteria then causes inflammation in the valves as the blood is passing through to kind of go wherever it needs to go next to be filtered. And so 75% of middle-aged dogs are diagnosed with gum disease, and those pets then have oftentimes increased risk of heart disease. So they did a study out of Purdue with 60,000 dogs. They were able to look back on their records, and we were able to find that these pets showed evidence of combined dental disease and heart disease. It's not an exact, cause, so we don't call it a causation. We can't tell that one causes the other. There's lots of other components that lead into our pets having heart disease, but there's definitely a correlation there, and it's quite striking. So we know that these play a role in this as well. And so we see that by cleaning the teeth, especially a dental cleaning under anesthesia, to get that bacteria out from under the gum line, one of the things we see is these anesthesia-free dentals, which from a comfort level for our pets, let's talk that, let's not even talk medically, makes me so nervous for our dogs. Most people fear and hate going to the dentist, having their mouth open, and we know what's happening, and we know why it's important, and we still don't like it, and we still fear it. So imagine your pet who, on top of that normal fear, doesn't know what's going on and why somebody has to open their mouth and stick instruments in their mouth and do all of these things. So I can only imagine how fearful and painful that must be. But then also consider that because of all that's going on and they're awake, that we can't get under the gum line and get all that bacteria out. So you're still not getting that overall health benefit to our other organs by having anesthesia-free dental. The teeth may look prettier and there's less tartar on the outside, but we're not getting that bacteria out from under the gum line. That does take an ultrasonic scaler that really can only be done under anesthesia to get all of that bacteria out. We also use fluoride and other, rinses to help prevent and get rid of some of that bacteria. So important from a fear perspective and from an overall health perspective, that our pets get dental center anesthesia. And we, as an AHA accredited hospital, we're doing such a good job with our anesthesia nowadays that they do say that our risk of anesthetic problems, because of course anesthesia has risks, are so much lower now that actually these complications from dental disease have a much higher risk than actual anesthetic complications, because we're doing such a good job with this now, with anesthesia now. So I hope that gave you guys a little bit more insight into not just the aesthetic reason we like to have our dog's teeth cleaned, because we like a good smelling breath in our pets when they kiss us. Trust me, I do too. But also that overall health reason as to why it's so incredibly important. So give this video a like, share it with your friends that have that pet that, they got some breath issues. Share it with them. They'll find it interesting. And I think it'll be so important for them to know the health benefits of having their pets' teeth cleaned. Give this video a like and a share, and I'll see you guys next week.